great time, and it was on our way home from that game that a little something happened that changed me forever. Now, we left the hockey game that night. Tom is driving. I'm riding shotgun. Our two friends, Kim and Vince, are in the back seat. We are headed south down a street called Hampton Avenue. We pull up to the cross street called Chippewa Avenue, and we've got a red light. So what do? Stop, of course. Well, as we're pulling up to stop, the light turns green, so it's our turn to go. Tom shifts the car into second. We pull out into that intersection. Now, from my vantage point, riding shotgun, front passenger seat, when we pull into that intersection, I should be able to look out my right-hand side window right here and see all the cars that are coming down the street at me, right? That's what should happen. When I turned and looked out that window, all I could see was a pair of headlights about that far from my face. And I had a microsecond to understand that those were headlights, that they were attached to a white car. That white car was coming very fast, and that white car was very close. And then just that quick, those lights were gone. I am not a healthcare professional. I did, within the last 6 months, just graduate with my master's in a field called narrative medicine from Columbia University in New York. And the whole idea of narrative medicine is to take these very complex stories of hospitalization and healthcare and illness and disease and death and dying and recovery, take these stories and to try to turn them into something from which others can learn, including the storyteller, him or herself. But I am not a healthcare professional. So I don't have a whole alphabet soup behind my name like many of you do. So when it comes to healthcare things, medical things that I don't understand, I think this is human nature. You don't understand something, so you try to relate it to something that you do understand, right? Well, from the moment that I saw those headlights, I went into shock. And I don't even know what the medical definition of shock is, but see if this bodes well for a layman's definition. Shock is a gift. Shock is a gift that the human body receives when an experience is so bad that our brain needs to block out the memory of that experience. Does that seem sort of sensible? Okay, if shock is a gift, I only got a very small portion of that gift. I don't remember our car barrel rolling through the intersection. I don't remember our car coming to land on its roof off to the side of the intersection, and I don't have any recollection of how myself nor my three friends got out of that vehicle. However, once I was outside of the car, that's when that gift of shock was gone, and that's when my memory kicked back in, my consciousness. When I came to consciousness, I was laying face down, stomach down, chest down in the street with my right cheek pressed into the pavement, my right arm up above my head like I'm waving at the concrete. And when I come to consciousness, I can feel every bone in my face just crushed. Just like if you took an aluminum can and crumpled it up as tight as you can. Now, what is the human reaction to instantaneous and horrific pain like a broken bone? Scream, exactly. Well, I can't scream because my mouth is too full of blood and broken teeth and gasoline that I can't suck any oxygen down into my lungs. And I can very vividly remember using my tongue like a drill to spit this mess out onto the pavement so I could open up an airway. Now, once I got that first lungful of life-giving oxygen and expelled that first scream, that is the point when I noticed that my left jaw was hanging off of its hinge. And that is the moment when I thought I was going to die. You ever said those words? Thought I was going to die? Now, ADD story. I have severe attention deficit disorder. Can you tell? All right. So I understand that some of you may, and when it was never truly diagnosed, but whenever I was a little kid, you just got the label of hyper, right? This is before medications came along. So I understand that some of you may have a little ADD, or maybe it's just the instantaneous world that we live in. But if your mind starts to drift, as mine typically does when I'm listening to somebody talk for an hour, I'm going to smack my hands, step over here, and what I want to do is give you a completely random story, and then try to tie it back in with what we were talking about in order to retain your attention. Is that okay? So, my ADD story. My question for you was, have you ever said those words, I thought I was going to die? Because the first time I remember saying those words wasn't in that intersection. First time I remember saying those words, I was in 6th grade at a middle school dance. Remember those? When all the guys are over here and all the girls are over here, and what's going on in the middle? Absolutely nothing, right? So I decide I better go dance, and I make the long trek across the Montgomery County R2 middle school gymnasium floor, and I walk up to Angie Adams, and I ask her if she wants to dance. And she turned up her beautiful little nose and walked away from me. And I thought I was going to die. And I've been very guilty about saying that at other times. I was so sick I thought I was going to die, so tired I thought I was going to die. But I got to tell you, when you're looking death in the face like I was at that moment, it's anything but funny. It's just scary. Luckily, I was only about 3 miles away from the Level 1 Trauma Center at Barnes-Jewish Hospital in St. Louis. The paramedics scooped me up, rushed me to the emergency room, pulled me into the emergency room, and the trauma team went to work on me. Now, I am a dumb 18-year-old young man, so I have no idea what the trauma team is going to do for me in the ER. And I'm going to ask you this same question. What is the first thing that you do when encountering any medical situation? I'm hearing different answers. I think it's such a no-brainer that we forget about it because we do it so inherently. You assess the situation, right? Well, they can't assess anything on me because I'm dressed basically the same way I am today, had a long pair of pants, long sleeve shirt on, and of course I am a dumb 18-year-old kid. I have all these misconceptions. I thought they'll come along and nicely unbutton my shirt and, wash the blood out with some Tide and give it back to me later on a hanger. Is that going to happen? What's going to happen? Cut them off, slice them off, tear them off. Now, here's the thing. I am laying on death's doorstep at this moment, and yet the only thing I am thinking as someone takes a scissors and slices down the right leg of my pants, the only thing I'm thinking is, dude, this sucks. This is my favorite pair of Levi's. I'm so fortunate that trauma team was a little more concerned with saving my life than saving my wardrobe. I don't remember a lot about that night. I don't remember much at all, actually. I had the blessed gift of unconsciousness. And I don't know if that was sleep, if it was being knocked unconscious, if it was narcotic induced. I don't know what it was. But when you're unconscious, everything's okay because it doesn't hurt, right? Well, the thing of it is I could go from unconsciousness back into the here and now just that quick. And when I would enter the world of the here and now, I would enter a world that was filled with pain and terror and blackness. Pain and terror and blackness. And the only thing that was pleasurable in this world of pain and terror and blackness was the fact that somebody was holding my hand. And the person to whom this hand belonged, I could tell the hand was female, and whenever I would shift, this very quiet female voice would say to me, "Hey Marcus, my name is Jennifer. You were in a car accident, and you're in the hospital." Bare bones information. Marcus, you were in a car accident, you're in the hospital. My name is Jennifer. And then Jennifer said the two most compassionate words I think any human being can say to another. I'm here. I'm here. And I didn't even know where here was, but I knew that in this most vulnerable moment of my life, I was not alone. I was not alone. Jennifer was there with me. Let's play a little guessing game. Anybody want to take a guess what Jennifer's role in the emergency room was? Nurse? What else? Housekeeping, did I hear? That'd be interesting. I didn't know what Jennifer's actual role was until about 6 weeks ago when I was reintroduced to her for the first time in 20 years. I was back at Barnes-Jewish Hospital delivering presentations, and after one of the presentations, my client came up front and said, "Marcus, we've got a surprise for you. We found Jennifer." And to be able to hold that hand that held mine all night and to say thank you for the first time in 2 decades was absolutely one of the most magical moments of my life. Jennifer was a 20-year-old patient care tech at that time. She is now a clinical nurse manager over 150 nurses at Barnes-Jewish Hospital. Now, let's think about this for a second. Did Jennifer have a giant alphabet soup behind her name? No. Did she have 20 years of experience and residency and internships and all that kind of stuff? No. She had she's a 20-year-old patient care tech. But yet, in that moment, Jennifer knew what I needed more than anything else: simple human presence.